A rapid response team is continuing to test residents and staff at a central Queensland aged care facility after a nurse tested positive for coronavirus. So far, 193 staff and patients have returned negative tests. Jemima Burt has more from Rockhampton and joins us now. So Jemima, just bring us up to date on the latest that's known there at Rockhampton.
Good morning, Miriam. As you just mentioned, there's been just about 200 tests returned negative, which is really good news. We've heard that this morning from the Health Minister, Stephen Miles, that this nurse was an administrative worker who worked in a particular wing here, and that all of those residents in that wing and staff in that wing so far have also returned negative results. We heard from the Health Minister just a little while ago. He said the investigation into how this nurse came to be at work while ill and also while waiting for coronavirus test results, the investigation's happening.
All 193 tests have returned negative, which of course is the best we could have hoped for out of that batch of testing. However, everybody, including the residents, their families, the staff, the entire Rockhampton community, should rest assured that we are taking the risks here very seriously.
Stephen Miles there. So Jemima, of course, an investigation there is underway, but do we know any more detail about the circumstances leading up to that diagnosis?
Well, Miriam, what we know so far is that this infection was likely contracted when this particular nurse went to Brisbane for an essential trip. There's no concern. Chief Health Officer Jeanette Young has said there's no concern about that trip. It was made for an essential reason, and there was no error there. But what she has said is it's been very concerning that this nurse has been at work while unwell, and also the fact that she has come back to work while awaiting test results. She has said that the nurse was only showing very mild symptoms, but there is a thorough investigation underway about how she came to be at work and slipped through all the testing processes and all that sort of thing for quite a number of days. So that's underway, and hopefully there'll be some answers there soon.
Our reporter Jemima Burt with the latest there from Rockhampton in Queensland. Victoria has recorded another 11 cases of coronavirus overnight. This brings the state's total to 1,554. There have been 158 cases of community transmission, an increase of 4 from yesterday. Health Minister Jenny Mikako says 3 of the latest cases are linked to identified clusters.
Today's new cases include 2 linked to the Cedar Meats outbreak. And I understand that 4 previously reported cases have also now been linked to Cedar Meats, taking the total for that cluster to 98, and that includes 64 staff and 34 close contacts. Other new cases today include 1 associated with McDonald's Faulkner outbreak, 1 is in hotel quarantine, and there are 6 household contacts of confirmed cases, as well as 3 pending investigation.
Thousands of Queensland and ACT businesses are reopening as coronavirus restrictions begin to ease across the country. From today, restaurants, cafes, bars and pubs are allowed to open up to 10 dining customers at a time, with social distancing rules in place. It comes after establishments in New South Wales enjoyed their first day of sit-down customers in weeks, and in the Northern Territory, people have rushed to pubs and restaurants to celebrate the easing of restrictions. George Roberts has more details from Brisbane.
As of midnight last night, you can have a party of 5 at your place. Previously, it was only one household could visit another household. Now you're allowed to have 5 people over, regardless of which home or house they come from. You can also go and dine out at a local cafe, restaurant, hotel or RSL or pub. They can have 10 sit-down customers as long as social distancing is still observed. And you can travel up to 150 kilometres for recreational purposes. Previously, as of Mother's Day, that was just 50 kilometres. Also, those restrictions easing extend to parks, libraries, churches, weddings, auction homes and PT sessions of 10 people. You can also go to state and national parks. If you live in regional Queensland, so in the outback, if you're not from the major centres, you can also have 20 dine-in customers, and you can travel up to 500 kilometres for recreational purposes. You can also have weddings, of course, and beauty salons can also have customers too now. So this represents a gradual easing of restrictions. For some businesses, of course, that won't be viable, just having 10 sit-down customers. But for others, that just represents a gradual easing, an opening up and some hope on the horizon. There are also 3 islands, Moreton Bay Island and North Stradbroke Island, that are opening up, and Fraser Island to day trippers. That's a bit controversial because locals didn't want day trippers to be allowed. They wanted some of the people who have second homes there to be allowed first. But again, this all represents the gradual easing as the economy tries to get back to life and the government tests how this is going and how we can come back to normal.
While in the ACT, hospitality venues are able to have a limited number of dine-in customers from today, many say it's not worth their while. Reporter Talia Roy joins us now from Canberra. So, Talia, is there a bit of a buzz around cafes and restaurants where you are this morning?
Well, I've found one, Miriam. So today, cafes and restaurants are allowed to have 10 people dine in, but it's been really hard to find those businesses who are actually taking advantage of that today. But the cafe behind me, they've had people coming and going for dine-in food and coffee for most of the morning. So, but yeah, most businesses, because as you can imagine, to offer table service at a cafe or a restaurant, that requires a certain amount of staff. Could be up to 10 staff when you factor in the kitchen and the people at the till as well. And so it's hardly going to be worth people's while to be having the same amount of staff as customers at any one time in that business. But takeaway is still thriving here in the ACT. So most businesses say that they're going to continue with the takeaways and the deliveries, and they're just going to hold out a little bit longer because they're really hoping that the next round of restrictions will see even more people be allowed to come back into their businesses.
So a bit of a balancing act there. And Talia, what else is opening up today?
So we have our lovely Tidbinbilla Nature Reserve, which is reopening to the public today, so people can get out there for a bit of a walk. It's a pretty nice day today. The started off a bit overcast and the mornings have been really chilly here in Canberra, but if you feel like a bushwalk, that park is open today. You can also head to a pool, you can have a barbecue outdoors, you can take the kids to a playground, and also local community sport is back on from today as well, but that's just for non-contact sport and, you know, stuff like throwing a frisbee, kicking a ball, informal kind of activities like that.
So get out and about, but just keep some physical distancing. Our reporter Talia Roy there from the ACT. Concerns have been raised about whether hospitals will be able to secure enough personal protective equipment as elective surgeries ramp up. The National Cabinet has agreed to allow all elective surgeries to go ahead now that the spread of COVID-19 has slowed. Tony Bartoni, the president of the Australian Medical Association, says that any further delays could cause more harm. The 25% increase in elective surgeries that's already occurred proves that the sector has the ability to handle further easing.
We've seen that even with that amount of activity and with the additional PPE and with the still that idle bed capacity, we've more than coped with that and beyond. We've got that idle capacity waiting and ready. We have the ability to, as I say, with the data, look at the contact tracing as we see things. We can always vary that very quickly in the process. But at the moment, what we're risking is that with the delay in presentations and the delay in treatment for a whole raft of conditions, we're risking unnecessary and unforetold numerous amounts of complications, increase in morbidity of illnesses and other issues that we're dealing with, and indeed some people will find that they have to increase the therapeutic options to their need as we go down into the future.
The head of the World Health Organization has called for global solidarity in the development of a potential COVID-19 vaccine. Dr. Tedros Ghebreyesus says medical scientists are working at breakneck speed to develop any such vaccine to tackle the impact of the pandemic. He said once developed, equitable access to the vaccine is essential.
Researchers are working at breakneck speed both to understand the virus and also to develop potential vaccines, medicines, and other technologies. The Access to COVID-19 Accelerator is uniting efforts on many fronts to ensure we have safe, effective, and affordable therapeutics and vaccines in the shortest time possible. These tools provide additional hope of overcoming COVID-19, but they will not end the pandemic if we cannot ensure equitable access to them.
A potential coronavirus vaccine being researched in the US appears to have limited the severity of the disease in monkeys. With human trials now taking place, President Donald Trump says he's hopeful a vaccine will be on the market by the year's end. North America correspondent David Lipson has more from Washington.
We've got to be a little bit careful about these vaccines because there's a lot of uncertainty around them, but early suggestions have pointed to some success. This is a joint study being done by researchers here in the US, also from Oxford University, but the trial took place here in the United States, and what they have done is injected 6 rhesus macaque monkeys with this vaccine and then exposed them to COVID-19. What they found is that those monkeys that had the vaccine showed significantly less damage to their lungs. It seemed like they were protected from getting the pneumonia-like symptoms that come with some of the more severe cases of COVID-19. So that is very promising news. And as you mentioned, they are now rolling this out for humans as well. A human clinical trial is already underway. So we will very much eagerly await the results of that trial as well. Donald Trump has said he hopes to see that a vaccine, whether it's this one or one of the many others that are being investigated right now all around the world, would be on the market by the end of the year. Now, that doesn't necessarily mean that they would be available for everyone. Of course, getting them on the market for a few or even a few million people is very different to the billions of vaccines that the world is crying out for now. But either way, Donald Trump says he and the United States is cooperating with countries all over the world that are racing to find a vaccine. And he says that he and America has no ego when it comes to that race. Take a look.
So we're working together with many different countries. And again, we have no ego. We have no ego. Whoever gets it, we think it's great. We're going to work with them. They're going to work with us. Likewise, if we get it, we're going to be working with them.
Now, we've heard a lot of promises from various leaders, Donald Trump included, that haven't come to bear. Let's just hope that this is not one of those and that we can have a vaccine sooner rather than later. But the thing to stress is that there's just no guarantee that we'll get an effective vaccine in a short period of time. And perhaps, as some have warned, there may never be an effective vaccine. It is such a very difficult code to crack.
In the UK, scientists are warning the COVID-19 reproduction, or R rate, is increasing and is now between 0.7 and 1. It needs to stay at 1 or below to avoid a second peak. Europe correspondent Samantha Hawley found this update from the British capital.
The UK is entering its first weekend since some of the lockdown restrictions were lifted. But with the death toll edging towards 35,000, the government is urging people to continue to obey the social distancing rules.
The number of deaths is falling each day in all settings, thankfully, and we are past the peak of this virus.
Here in the UK, there's fierce debate over whether the government is moving too quickly to lift restrictions, as it's expected to ease more of the measures in June. Among those will be bringing some primary school students back to school from the beginning of next month.
We're constantly keeping the R under review, and it is one of our 5 tests is for R to be below 1. The latest evidence that Dr. Harries has presented is that the R is between 0.7 and 1. So we don't think that it's above 1. We think that it is in a range between 0.7 and 1. So that still meets that test. But of course, we're constantly looking at and updating all of the information that we see.
The government's been criticised for sending mixed messages about what people can and cannot do since it dropped its stay home slogan. This weekend will be a real test to see how people behave. But police have warned they have no power to enforce the social distancing restrictions.